Hey everybody, welcome back to another episode of Regen Med Podcast. My name's Lindsay and I'm here with Dr. Abraham.
Hey everybody, I'm here with Lindsay.
And on today's podcast, we're going to talk about treatment that we actually talked about in the last podcast briefly.
A2M?
A2M.
Perfect, yeah. We were talking about PRP and we mentioned A2M at the end of the last podcast, so we can jump into that a little bit more.
What that's all about.
Yeah. I think we'll talk about it in the context of what things can you do to support PRP or what other, because the main topic was platelet-rich plasma, and then there are a few ways that you can supplement the PRP or you can enhance it in certain situations. I think that's where it came up, so we can definitely.
Yeah. A lot of people aren't familiar with A2M. It's specifically meant, is it something that you only can combine when you're doing injections into like joint pain?
So in terms of when we're doing it with PRP, most of the times we are using it in joint. And the reason is, so A2M, what it stands for is alpha-2 microglobulin. And it's basically like a large protein that's found in the plasma. So just kind of like briefly, when we're talking about PRP, we're talking about platelet-rich plasma. We're starting with the patient's own blood, and then we're concentrating. We're taking the platelets, we're taking the platelets out. We're concentrating the platelets in the plasma, and we're injecting that. Mm-hmm. Now, another protein that is found in the plasma is A2M, alpha-2 microglobulin, and it's a large protein, and one of its main function is that it inhibits an enzyme. A protease enzyme. So basically what we're doing with an A2M injection, and I'll talk a little bit more about the enzyme in a second, but we're not just taking the platelets out, we are taking the A2M, we're trying to concentrate that protein, and we are injecting that protein. And to answer your questions, we often are doing it in a joint. And the reason to put that together is because protease is one of the enzymes that one of the things it does is it breaks down cartilage. So it can break down the cartilage in the in a knee joint, for example, right? So in conditions like arthritis or things like that, osteoarthritis, there's cartilage breakdown which causes pain and issues in the joint. And so there's a protease, there's an enzyme called protease that does some of that breaking down. And what A2M does, one of its function, it also plays a function in the kind of with immune cells and a few other things. But one of the main functions of A2M is to inhibit or to stop that protease enzyme from working. So it's stopping that protease from breaking down the cartilage in the joint, which is why it can be very useful in the joint as an addition to PRP. And it actually works pretty cool. It kind of like forms a cage or encases the protease so that it can't really break down the collagen or proteins anymore. But yeah, that's how it works. So a lot of times when people are doing or when people have osteoarthritis and they are having issues in their joint, one possibility is to inject the PRP because you still want to get all these benefits from the PRP. Mm-hmm. So many times we kind of combine the two. We inject the PRP, but in addition to that, we're also injecting the A2M. And the idea is that is going to be even superior to just injecting PRP because you are still getting the benefits of the PRP, but again, you're adding the A2M on top of that.
And the A2M's main function is to prevent the cartilage from continuing to break down. And then does it have any other purpose outside of that?
It does play other roles in this context. That's the main purpose. So as we've mentioned, like it works with certain cytokines and enzymes and other things, so it has like function in like in the immune system as well. And part of the reason it does too is because protease isn't really specific to cartilage, so the enzyme that it inhibits isn't specifically it's not specific only to cartilage, so that enzyme plays other roles and breaks down other tissue and other proteins in the body. So in that way, by inhibiting that protease enzyme, it can also has multiple other functions. But the main one we're looking at in terms of joint rejuvenation is gonna be the protease and the cartilage breakdown, just because again we want to stop the osteoarthritis from progressing, so rapidly, and we want to preserve kind of the cartilage that we have. And again, it just falls in the context of uh, things that can be done with PRP to support PRP. Now, that doesn't mean that every time you do PRP for anything, you want to add A2M to it. It just goes back to figuring out what the situation is and seeing if that is a valid option for that person. Again, it doesn't mean that A2M with PRP is always better than just PRP alone. Again, it's going to depend on what you're doing. But there is a way to enhance the PRP in certain situations where it's appropriate to do that step. For example, there are other ways to, there's, I think it's called a super shot PRP, and just the super shot PRP is just like a name that a company came up with because it's a cool name, but it's a different like technique where what we do is we try to get the extracellular vesicles that are also found in the plasma. So again, we're starting with the same thing. We're starting with the blood. We're concentrating the platelets. We're getting the platelet-rich plasma, and then usually what we're doing, we're throwing away the rest of the blood, right? That's not platelet-rich plasma. But with the A2M, instead of throwing that, that rest of the blood away, we are trying to get the A2M. There's in other procedures, for example, like the super shot PRP, like I was saying, where we're taking, before we throw away that rest of the blood, we're trying to concentrate, a different product or a different protein in that blood. And in that case, what we're going for is the extracellular vesicles, which are these little, basically vesicles that are going to be in the blood that are going to contain things like proteins and molecules like RNA that can also play a role in cell signaling. And then we're adding that to the PRP. So that wouldn't be necessarily maybe something that you're doing in a joint. Maybe in a joint you're doing A2M, but maybe in like let's say an aesthetic cosmetic procedure for the face, we often use that, or maybe with the hair. But you are trying to extract few extra proteins from the blood to add to the PRP to try to enhance the PRP. And you're not, it's not like there's always one procedure that's better than the other. Just kind of knowing all these options and figuring out how you want to personalize it to each individual kind of thing in each
It's cool
case.
though that your blood contains all these things that you can kind of extract from it and then infuse
Re-inject.
back.
Exactly, yeah,
But
yeah. And it's not the only way to even like work with PRP or enhance PRP, if you will, or change PRP, if you will, right? Because the other very common thing we do with that's related to PRP is something like PRF, which is platelet-rich fibrin, which in that case, so PRP is platelet-rich plasma, so we are going after the platelets. Platelet-rich fibrin, we're still going after the platelet, but the difference now, instead of it being plasma, it's it's platelet-rich fibrin. So we have it in a fibrin mesh. And the difference between PRP and PRF, or one of the differences is, again, when you look at PRP, it's like a liquid, right? Sometimes we call it like the golden plasma, or just because, again, it's like that yellow liquid. With the fibrin, fibrin is also another protein. It's a fibrous protein, which is why it's called fibrin. And one of its main functions is to form that like fibrous mesh. So like when there's a cut, for example, and you need to form a blood clot, the fibrin plays a role in kind of forming a mesh and kind of closing that to help the person stop bleeding. But it's going to be more solid like than a PRP because it's a mesh. So with PRF, what you're doing is you're spinning it differently, or you're maybe manipulating it in a minimal way, but to kind of activate that protein. And instead of it being a liquid, you form more of a gel-like, or it's a little bit more firm, a little bit more solid, because the fibrin has been activated. So if you want it, sometimes the PRP to stay in one area, like for example when we're doing under eye treatments in the cosmetic world, sometimes doing PRF can have a little bit of an advantage over PRP in that situation.
interesting.
Yeah, just another way to kind of like again play with PRP, which is part of the reason like overall I really like PRP is because it's like there's so many things you can work with. It's like it's just PRP is just the tip of the iceberg, right? But there are so many things like we've talked about, whether it's things like A2M or the super shot with the extracellular vesicle, or whether it's using PRF, or there's the PRP biofiller. Sometimes it's called. It's what Easy Gel is probably the most commonly known company in the US that works with the biofiller, which is made from PRP. And we're also starting with something kind of like PRP or PRF, but we're processing it in a way to make it again a little bit more like a gel-like substance, and sometimes it's used in a similar way that we would use like filler in the under eye. So again, it's just like all these different ways to work with PRP, and another reason I really like that
That's
PRP
cool.
subject.
Yeah. Because you can inject it in different areas of the body, extract different parts of the blood and the platelets, and then they all serve different functions in healing and regenerative.
100%,
regeneration.
and that way you can personalize it to your specific need, to the specific patient, the specific location. And sometimes all you really need is just plain old PRP, uh, which again, as we've talked in the previous thing, like not all PRP is the same. So even within, if we're just talking about PRP, there's still like the different concentrations of PRP. Like there's so much to dive in just there within PRP. But beyond that, you can also sometimes you just want to do PRP, but sometimes it does make sense to do, to alter it in a way and do either, again, PRF or Easy Gel, the biofiller, PRP, the A2M, some of the other products. And it's not just A2M, there are also like sometimes we do it with like growth factors or proteins or other things that are specific to that, to that situation. But the good thing about doing A2M is, for example, when we're talking about the joint, is that it's still, as we've mentioned before, it's still, the patient's own proteins. It's their own vesicles, if we're talking about the extracellular vesicles. So whatever we are extracting from that blood, we are extracting from the patient's blood. So it's still, from the patient to himself in a way, which has many advantages.
Yeah, it's just essentially it's like medicine from your own body back into your body, and utilizing it differently in different ways to help with different things, which is awesome.
Yeah, just helping restore, some the balance or the harmony when things start to go out, because your body already has a lot of like, your body is what has built this tissue in the first place, right? And when when these tissues get damaged, your body usually repairs it. But again, there are sometimes when there isn't enough blood supply getting there, or the damage is just too much, or the healing process is slowed down, or for whatever reason, you might not get as much of that naturally. But we are using again what your product usually uses to heal itself. We're just kind of concentrating it. We're adding it more. We're putting the right things together in the right place at the right time, just to kind of help like really improve that process. And yeah,
That's awesome. So I guess people now need to like look into if A2M is a better alternative to add on to a treatment, or if PRF is a better alternative to add on to a facial treatment for rejuvenation.
yeah. I mean, I think that's the main idea. It's not about specifically A2M or specifically PRF. It's just kind of knowing that PRP is sometimes great on its own, but it's not the only option. And sometimes even within PRP, there are slight alternatives where you're still using PRP, but you are enhancing it one way or the other, whether it's through A2M or a different process, or whether you're going for PRF. But yeah, and in some cases, doing PRF would not make sense, like, or some cases doing A2M would not make sense because that's not what you're trying to achieve. But in many cases it is. So just kind of knowing that there are a lot of options, asking a lot of questions, and figuring out what all your options are to make sure that you get the best treatment, the best option.
That's awesome. I love that.
Yeah.
Love options.
Exactly.
So I guess that's it for today's episode.
Yeah. I think, and we can jump even more into like the Easy Gel and PRF. So we can do that like, next time, or the PRP biofiller, because it's like a different topic in a way. It's more the kind of has to do with the cosmetics, regenerative, the cosmetic part of regenerative medicine. So it is definitely something that we can talk a little bit more about next time.
Awesome. Alrighty. Well, we'll see you all next week, and thanks for hanging with us and learning all about the PRP.
Yeah. Thank you guys for joining. See you next time.